And I personally want to share that I think this is a really important topic because, so much of what we learn in med schools today, you can look up, you've got the phone, we've got apps, but really helping people change, helping people implement change, working with them, that's not on an app. That's not something that we can so easily just learn. So I think that's why we are so fortunate today to be joined by Dr. Lydia Altini, who is not just one of the founding members of SALMA and our secretary, but she's an incredible doctor. She obtained her medical degree from BITS and then went on to do microbiology at Groote in Cape Town. In this role, she joined infectious diseases, and in her role in the School of Public Health and Family Medicine at UCT, she actually became the deputy director and head of microbicides research. And this research she did, particularly in HIV and STI prevention, really made her passionate about preventative medicine. From there, she moved into private practice and focused on preventative medicine, management, chronic diseases, and lifestyle interventions, obtaining a certification in lifestyle medicine, health and wellness coaching, and a postgraduate certificate in mindfulness-based interventions. She is truly knowledgeable on the topic of coaching, lifestyle medicine, and how we can make a difference for our patients. So I'm sure, just like all of you, I'm very excited to learn from her today. Hello, Lydia.
Thanks, Rikira. That was so kind of you. Thank you very much. It's so lovely to be here and see so many familiar names. I can't see all your faces, but yeah, most of you I know. Lovely. So I will share my screen. So let me do the slideshow. Oh, can't see how to do slideshow here.
Down the bottom on the right hand, right at the very bottom.
At the bottom on the right hand side.
Yeah, next to. There's a little, like, it looks like a goblet. Sitting up there.
If you look at the bottom right of your screen, just to the left of the zoom in and out scrolling icon, it looks like a screen that's been pulled down. Move your cursor down.
Down?
Right at the
Maybe
down.
it's been covered.
And then to the right.
Yeah.
Right.
Sorry, I
To the
don't see
right.
anything. Oh, you at the bottom.
And
oh,
yeah,
there. This.
That's the one. Yes.
Okay. Thank you. Okay. All right. So yes, tonight's, well, it's tonight for me, but today for you, I'm going to be talking about the coaching approach to behavior change. And before I begin, I want to acknowledge two coaches. One is Simon Matthews from Well Coaches Australia, and the other is Siobhan Khan from Accredited Health Coaching Australia, and they are both trainers and mentors, and I've learned so much from them. So I just wanted to acknowledge them because they have truly inspired this presentation today. So the objectives for today, we're going to focus on, oh, I'm sorry, but my Zoom, I'm just going to move it, see if I can move it over, because it's hiding what I can read on my slides.
Maybe you can minimize the pictures.
Yes, I've minimized it now. Okay, it's gone. Good. Okay, so I'll talk briefly about why we need to focus on behavior change, why that's important, and then we'll look at the challenges that are faced by health providers and patients. We'll look at some benefits of health coaching. Then I'll move into talking a little bit about health coaching psychology, stages of change, and we'll go through some effective coaching conversations. And lastly, I'll finish off with by introducing Simon Matthews that I mentioned, and he and I are going to demonstrate using his brief behavioral intervention, which is called the quick intervention for change. And so then you'll see everything that I've been speaking about come to life. And now, there we go. Okay. So I don't think I'm sure I'm preaching to the choir here, but just to set the scene, the biggest killers worldwide are cardiovascular disease, type 2 diabetes, chronic respiratory diseases, and cancer. And as you all know, these are fast becoming the leading causes of death in South Africa. And we know that non-communicable diseases actually result from a very complex interplay between genetics, our socioeconomic environment, and lifestyle factors. And I think working in South Africa, it's very easy to feel overwhelmed when one thinks, how much is out of our control, particularly in the domain of socioeconomic environment. So I'm hoping that tonight we can realize that behavioral factors, this is where we can intervene. And all of these chronic diseases share common risk factors like tobacco use, physical inactivity, alcohol abuse, and unhealthy diets. So in other words, unhealthy lifestyles. And so supporting our patients to change their behavior really has to be part of the solution. Now, I don't believe that we get near enough training in medical school on how to do this. We learn how to screen for risk factors and we can educate, but until we can actually engage our patients and support them to take responsibility for their own outcomes, then we're not really going to get anywhere. So I'd love to know, before I move on, I'd love to know from all of you, what are the biggest challenges that you face in your practices when it comes to helping your patients change their behavior? And please put that into the chat box. Maybe you have come across some of these challenges. These come from a study done in 2015. And the health providers complained of a lack of time. That was one of the most commonly reported challenges, a lack of time to provide education and counseling and to make referrals. It was also reported by the health providers that they didn't have the training and the confidence to help their patients. There was a lack of continuity of care. They didn't feel supported in their practices or clinics by processes and systems. They also lacked educational resources, and they lacked available, being able to, there weren't enough referral linkages with allied services and community-based resources. So those are all very real challenges, but we can also fall into the trap ourselves of making our own assumptions. And these, I think, also need to be challenged. So we assume that the patients we see don't change their behaviors because they're being difficult, they're full of excuses. We believe that it's our responsibility to make them change their behavior, and if they don't, then we feel we failed them. And of course, this renders them passive in the process. We can also mistakenly assume that our goals and priorities are the same as theirs. And I know that I can really identify with the last one. We also can believe that just providing education and advice, I mean, surely that's motivating and useful. So perhaps some of those will also resonate with you. And what about our patients? It's interesting to also see how they, see things from their perspective. And this is another study that was also done in 2015. It looked at the experiences of diabetic and hypertensive patients attending a public sector primary healthcare service. And it found that the patients reported not receiving enough information about their condition or counseling. And this really led them to feel quite anxious and frustrated with the quality of care. And of course, it also resulted in a lot of misperceptions or misperceptions. So one that is quite common, for example, is the belief that high blood pressure is caused by dirty blood. They also reported feeling a lack of empathy, and this could lead to feelings of shame. They reported a lack of reassurance and understanding from their health providers. And this may be why people often prefer to consult with traditional healers, because they actually feel perhaps more understood. They might feel that those traditional healers are more accommodating of their wishes and their treatment options. They reported also a lack of collaboration. They didn't feel that their autonomy was being supported. They felt a lack of self-confidence. They don't feel capable to make changes. Now, motivation, of course, is also a big one, and that was lacking. But where people did want to change, they lacked planning skills and implementation skills. And they also reported feeling a lack of support from their family and their friends. So what will my friends think of me if I stop smoking or I stop drinking? And of course, there's the environment in which people live. That's a huge factor as well. And social norms. For example, the social stigma of being thin amongst African women, as an example. No, these results are not unique to South Africa. They certainly have also been found in other studies around the world. So there's no doubt, looking at the challenges that providers face and the challenges that patients face, we really do need to relook at the way we're delivering lifestyle interventions. And so how can using a coaching approach help? I found this table really useful. This is from an article written by Siobhan Khan, and I think it really gives a lovely summary here of the difference between the traditional approach, which is how we as health professionals have been trained, and then the coaching approach. And again, I can identify fully with using the traditional approach. It caused me a great deal of frustration. For many, many years, I kept giving lots of advice and telling my patients what they needed to do, and nothing ever changed, or it never seemed to change. And when I discovered coaching and changed my approach, it's made my work so much more rewarding. And I think my patients have enjoyed it as well. So as you can see, when we use the traditional approach, the practitioner comes across as being the health expert. We provide the advice and solutions. We decide what the health priority is going to be. We focus on the problem, on why the patient hasn't made the changes. And we also often assume that the patient is actually ready to change when they may not be. So how does that look when we're using the coaching approach, when we put on that coaching hat? So here, the patient is respected as the expert in their own life. The practitioner will offer information only on the basis of what the patient identifies as needed. The patient chooses the health goals, the strategies, and targets. We, as the practitioner, look for positives and try to affirm the client. And we also do our best to identify client readiness and then offer strategies to increase confidence and importance. In other words, try to motivate. Now, it's not easy, of course, to take off our expert hats and put on the coaching hat, because it's not the way we're trained. We're trained to diagnose, to advise, to prescribe, and often we're problem orientated. And of course, that's what our patients also expect. So it may be a little bit uncomfortable for them too in the beginning to realize that they they're the ones that actually have to take control of their own health. But if we can make this shift in our consultations, then you will be amazed at the transformations that can follow. Now, this is an analogy that you may have come across if you've done motivational interviewing training. And I think it really describes the whole process beautifully. When we take control and we want to fix the patient, it can feel like a wrestling match with our patient being quite defensive. But when we use a coaching conversation, then it feels like a dance. Someone is still leading, so the practitioner is still leading the conversation, but without stepping on toes. So, and studies confirm the benefits of a health coaching approach. Here are some of them. Greater job satisfaction, which I can certainly vouch for, improved consultation efficiency and effectiveness, decreased reliance on the healthcare system, greater multidisciplinary collaboration, and the patients also feel so much more satisfied by the service and the outcomes. Right, so now I'm going to move on to talking a little bit more about the psychological principles that underpin health coaching. So health coaching encourages three very important things: self-determination, which is the process by which a person controls their own life. And part of self-determination is autonomy. Patients report that their autonomy is the one thing that's most often trodden on. When we say that you must do this or you should do this, then we're immediately treading on patients' autonomy, and that's something always to bear in mind. No one, not even ourselves, we don't like being told what to do. Self-efficacy, this is the belief that one has the capability to initiate and sustain a desired behavior. And then thirdly, is self-responsibility. So we want to empower our patients to grow into becoming the experts in their own health. There are many different coaching techniques and tools that one can use. Motivational interviewing is just one technique. But it's very interesting to see that research shows that it's actually the quality of the relationship between patient and provider that actually contributes much more to behavior change than any specific technique. And so one of the ways to think of coaching is as a growth promoting relationship. And it's really this quality that's the first coaching mechanism of action. So how can we cultivate a growth promoting relationship with our patients? So we can do this by focusing on our patient's strengths. So remember that your patient's not broken and doesn't need to be fixed. Okay, so celebrate their strengths. Maybe it's their determination, maybe their concern for their family, what they've already achieved, what they've done that's already working. And then we can also help our patients to see their potential to be creative and resourceful and resilient. And as I've said before, too often we tend to focus on what's wrong and not what's going well. And when we do help our patients to be more creative, then this can be very energizing for them. When they start to imagine new possibilities, it can really open them up. We also want to do our best to cultivate being skills, such as mindfulness. So in other words, the ability to be present in our consultations with our patients, empathy, authenticity, affirmation, courage, calm, playfulness. All of these attitudes can really help to make our patients feel more supported. And research shows that there's a very strong link actually between showing empathy and compassion and an improvement in patient outcomes like better HbA1c and blood pressure, for example. And then lastly, which I think is so important, listen more, talk less, be curious. We can use open-ended questions and perceptive reflections to try and help our patients to become more self-aware, to help them learn how to self-reflect and to self-regulate. Now, there are two other very important core coaching, what I would say are coaching mechanisms of action. And the first of those is motivation. Of course, if your patient is not motivated, then you're just fighting a lost cause. So how do you elicit self-motivation? And this is, of course, one of the techniques of the motivational interviewing technique. Or I should say one of the processes of the motivational interviewing technique. So there are two types of motivation, as you're probably all aware. We can be motivated by things outside of us, and there's internal motivation. So when we're externally motivated, then someone is telling us to do something, and it's usually we do it usually out of fear of the consequence, or we want to avoid conflict. And trying to motivate someone by reminding them of negative consequences, it only works for a short while. And I think that as doctors, we're pretty good at that. We focus on the negative. You really should do this. You ought to do that because this is going to happen. And it can work in the short term, but it doesn't really help people to make lasting changes. And to do that, we really need to connect them with their own internal sense of motivation. And that's the big why. So why does this actually matter? Why do I really want to lose weight? Why do I really want to get fit? What's going to be different about my life because of, if I'm able to do those things? If I'm healthier, well, what am I going to do with better health? Try to get them to connect with something that really, really matters to them. And when they do, then suddenly they have a reason for doing something differently. The third coaching mechanism of action is building confidence or self-efficacy. And this, as I've said, is the confidence in one's ability to overcome one's obstacles. And it's really as equally as important as eliciting motivation. They depend very much on each other because, of course, you may want to change, but if you don't believe you can, then you're not going to. Now, confidence is typically built over time. So you really help the patient to start small. You want to encourage your patient to select a habit that, while still a stretch, it's still within reach. Because if small changes are successful, then those are going to increase motivation and confidence, and then are going to lead to even bigger changes further down the road. So remember, success breeds success. Okay, so one of the common ways of assessing a patient's level of motivation and confidence is to use a scale. And these are very commonly used, and you'll see this in action a little bit later on. So we could ask, on a scale of 1 to 10, how important is it to you to make this change at this time? So we're assessing motivation. And then on a scale of 1 to 10, how confident are you that you can make this change? So we're assessing confidence there. And if the patient comes back to us and says, gives us a number less than 7 out of 10, then we know that we really need to do some more work on helping them to find that inner motivation and helping them to feel more confident. And I won't say more about this now because you'll see it a little bit later on in the demonstration and it'll make a lot more sense. Okay, so one very last theory that I just want to talk about before we move on is the trans-theoretical model of change. This was developed by Dr. James Prochaska, and it's also known as the stages of change. And you've probably come across this. It's a theory that says that one moves from not thinking about change, which is pre-contemplation, to eventually thinking about it, contemplation, then moving on to planning or preparation, before actually doing the behavior, which is the action, and then eventually maintaining it. And remember that these stages can be skipped. They can, one can move back and forth. You can stay in one for a very long time. And so why is this useful to know? If we know where our patient's at, then we can actually tailor our approach for each stage. And this can really help reduce our chances of becoming frustrated and help us to be much more effective. Because if we push a patient beyond what they are ready for, then they're going to resist. They're going to fail. And that's really not going to do their sense of self-confidence any good at all. So, even though we don't mean to, we can actually discourage change in our patients. So now that we've covered some coaching psychology, I want to just take you through those stages and just explain a little bit more about how we can have effective coaching conversations depending on in which stage our patients are at. So starting off with pre-contemplation, here the patient has no awareness of the problem and they're not planning on making any changes. So they're either saying, I won't, because they don't believe that they have a problem, or they're saying they can't, because they don't believe it's possible to change. And so at this stage, our patient really needs to feel accepted and understood, not judged. They should feel that their autonomy is being appreciated. And it can help to validate the good reasons for their unhealthy behavior. It might be meeting a need or helping the patient cope with the demands of their lives. And I think validating that can be really important. Personally, I found that life stresses really can get in the way of people feeling ready to make behavior changes. And so sometimes just supporting them to find ways to cope better with stress can be a really good place to start. And of course, it's a lifestyle intervention in itself. And then this can lead to further changes down the road. So if you find that your patient is at this stage, you could ask, may I share some more information with you? Or would you be open to having a chat about your condition and risk factors and how they relate to you? If not now, then would you be willing to come back? And even just getting them back for another conversation is a step forward. Moving on to contemplation. Here, the patient is considering change, but they're not so sure about it. They're still experiencing ambivalence. So for an example, they might say, well, on the one hand, I want to lose weight and improve my health. But on the other hand, I also enjoy socializing with my friends and drinking and, eating takeout on the weekends. So they're still weighing the pros and cons. And it's important to realize also that this is really, really common. It's perfectly normal. It's just part of the human condition. And at this stage, we want to help our patients connect their behavior with something that they value, so that we can help them to elicit internal motivation, something that's really meaningful to them. So we could ask them, what matters most to you? And they might say, well, my children matter. And then you could say, well, how does your health impact your children or your ability to spend time with your children? What kind of role model do you want to be? And so they start to see, they start to connect with something that's important to them. They also need a clear vision of what they want and not just what they don't want. So the three most important tasks here are really finding a motivator and helping them to see the barriers, and helping them to find some possible solutions. And then also to identify information gaps. So instead of just loading them with lots and lots of information and jumping in and actually wasting a lot of valuable time in the consultation, you could first of all find out what they already know and what they would like you to go through with them. Because you don't want to miss the opportunity, of course, to correct any misinformation that they might have. And then also getting them to connect with people who've been successful or who have made similar changes by sharing stories can also be a useful strategy. So here, for someone in contemplation, the goals are very much more about thinking about the barriers. You could let them go away, and they could think about what it is in their environment that is making them behave in this way. And then they can come back and tell you next time. So you're really just encouraging a mind shift here. Now, motivational interviewing is a technique that is perfect for a person who is at this contemplation stage. And I'm not going to go into it in any great detail at all, but I just wanted to remind you that it's just one technique, that it's used very specifically in the early stages of change. And what you're going to be doing is you're expressing empathy, you're developing discrepancy, so helping them see where they are and where they want to be. Roll with resistance, very important, remaining non-judgmental. The more you argue for change, the more that the person is going to feel compelled to argue against it. So you want to gently explore both sides of the argument with them, and then help them to work through the barriers. So you're supporting their self-efficacy. Okay, so just getting on to the preparation stage. Now the patient is feeling motivated, and they're starting to plan for change. They know what their barriers are. They might have come up with some possible solutions. So now it's time to start working with them on designing an action plan. And at this point, it's often tempting to start sharing your own tips and tricks and telling them what they should be doing and what they could be doing. But really, you want to allow them to come up with their own strategies, their own plans, because those are the ones that they're going to be more committed to. So you could help them to set goals by using SMART goals, which stands for specific, measurable, attainable, realistic, and time-bound. So an example of a SMART goal would be, I will do 30 minutes of walking each week on a Monday, Wednesday, and Friday after work with my best friend. Okay, so that covers all of those factors there. And then, yes, so we spoke about allowing them to take the lead in co-creating their own strategies and solutions. And then also helping them to find support by referring where needed. Okay, so now we're at the action stage. So now the patient is already practicing the new behavior, and they're doing it consistently, and they're building up week by week, month by month. And so in this stage, they really need our confidence in them so that they can stay on the path. I think we've all experienced this. Our level of motivation is never constant. It waxes and wanes. So we really, as their healthcare providers, need to help them to remain motivated by reminding them of their strengths and keeping them on track. It's also very valuable at this point for them to have lots of social support and to develop new relationships with people who share their interests and have the same goals. And of course, challenges are going to arise. They always do. And we can reframe those lapses as just temporary setbacks, as learning experiences, and we teach them to have a trial and correction approach. If someone has an all or nothing mentality, then it really just leads to guilt and self-blame and reasons to quit. So be kind, be curious, and you might ask them, for instance, how could you deal with that next time? What did you learn about yourself when that happened, etc. Okay, and then maintenance. So once a patient is in the maintenance stage, the new behavior is becoming a habit. This is usually at least 6 months after the initial behavior was started. And at this point, the patient is probably going to be feeling quite self-confident, and their confidence is reinforcing, self-reinforcing. So it doesn't mean that they're not going to relapse, though. There are definitely risks, such as boredom and going back into old habits. But again, remembering that lapses are temporary and providing support to set new goals and get refocused. Exploring the lessons learned, and helping patients to become role models for others can also help them actually stay really motivated as well. Right, so I think that's enough talking on my part. I'd like to introduce you now to Simon Matthews, the CEO of Well Coaches in Australia, who designed a rapid intervention that could be used in primary care in any setting. It's called the Quick Intervention for Change. It doesn't require any specific training in health coaching or motivational interviewing, and it can easily be used by anyone with any level of experience. So without further ado, I think and this is recorded, so I'll let Simon explain the QIC further. Thank you, everyone.
Minimize the screen, press escape.
So Yakira, can you hear me?
Okay.
Oh, there we go.
To be here and to discuss the quick intervention for change with you and your colleagues from the RSLM. I'll just briefly introduce myself before we dive in. My name's Simon Matthews. I'm a psychologist by training, Australian born, and I've practiced here for the entirety of my practice. I tumbled into lifestyle medicine about 10 years ago when I started reading more about the role of things like movement and activity and exercise and diet on mood in particular. So I had been sitting here for many years in this very office that I'm in right now, working with clients around issues of depression and anxiety and so on, and started to think, it looks like there's more to this. So I trained as a fitness trainer, added some nutrition knowledge and information to that as well, and then one day woke up and found that I'd tumbled into lifestyle medicine. And from that point, I became more and more interested in of course, being a psychologist, the behavioural change elements of health behaviour change. So what is it that we do? What is it that we need to do to support behavioural change? What's the least amount we can do? That's the question that I find enduringly fascinating. What's the smallest thing that we can do to support a meaningful behavioural change for someone else? So since that time, I've become a fellow of the Australasian Society of Lifestyle Medicine. I've undertaken the International Board of Lifestyle Medicine examination. I'm certified in health coaching and professional coaching as well. And a lot of my work now is consultancy to other lifestyle medicine organisations and companies around issues to do with health, well-being, vitality, thriving, and lifestyle medicine. So just prior to the pandemic, I was having discussions with a lot of physicians who were saying, yeah, look, we really love this. We really love these principles of health coaching. We really love this idea, but honestly, in general practice, there's just not the time to do this. You just don't have that amount of time to work with patients like that. And it struck me that that's kind of a shame because that's in many ways an ideal opportunity to work with patients. So I started exploring these ideas, and at about the same time, the Royal Australian College of General Practitioners published a report in 2019 indicating that the primary obstacles for physicians in general practice were firstly time, and secondly working with readiness for change in patients, and thirdly needing some skills to undertake brief interventions. Well, my eyes lit up because brief intervention was what I was trained in as a family therapist back in the 1990s, and there's a lot of really great evidence to support the impact of brief interventions, and of course there's also a lot of really great evidence to support the benefit of a health coaching approach as well. So I started putting together these ideas, which I ultimately called the quick intervention for change. So the parameters for me were to be able to conduct an interview like this in about 4 to 5 minutes, the sort of thing that with a little practice you could do while you're, strapping a blood pressure cuff to someone's arm, or taking one of those, hammers that GPs like using, hitting people on the knee, something like that you could be having a conversation with people at the same time. So, Lydia, what I would love to do is, first of all, just briefly step you through the process of the quick intervention for change, so people have a bit of an understanding of that, and then you and I can do a demonstration, and people can see it in action.
Great. Okay.
All right, wonderful, wonderful. So I'm going to just start sharing my screen here so that people can see that. There we go. That should be visible, I think, to people now. So you can see that we begin the quick process by asking the patient what's an area of their own health and well-being that they would like to focus on right now. This is very important because we're harnessing the power of autonomy here, the power of patient choice to be able to nominate what matters to them. And in hearing the response to this question, we get insights into how the patient constructs meaning in their own life and what really matters to them. You can see that next question too. What makes this important? This is a bit like going from what to so what. So the first question asks, what's the area? That's the what question. The next question really starts to get into so what. And why does this matter so much to you? What makes this important? And that's often where we start to hear motivations. We start to hear that what matters to this person is being able to play with kids, or play with grandkids, or go traveling next year, or join a group of friends socially on a tour of somewhere, whatever it might be. So we get to learn about those things that are going to motivate the person to really want to engage in some behavioural change. The next question about what's already working comes really out of the solution-focused school, and it's a question I learned to ask more than 30 years ago. A wonderful way of learning about resources, strengths, capacities, skills that the person already has. We also see it in appreciative approaches to healthcare and appreciative approaches to inquiry about people's health and well-being. But focusing not on what's the problem first, but focus first on what is working well, what can you harness, what do you have already in place that's working for you. Then a simple scaling question. If 0 means having made no progress, 10 is having reached the goal, where are you right now? This is what I call technically it's called a scaling question or a rating question. I call it a locating question too, because it enables us to locate ourselves very, very quickly in relation to whatever parameter we set. If I ask you right now, how much you're looking forward to having dinner tonight, you'll give me a number out of 10 straight away. And then we can start exploring what that means to you. How come you've settled on that number? So getting that sense of what matters to the person, then where they see themselves with respect to progress, and then where they attribute the meaning for that. What's making that important for them is where we head. After that, we get curious about that incremental change. What would a 1 point difference look like? And if you want, you can go smaller than that. You can go a half point difference. What does a half point difference look like to that person? So we have the patient describe that half point difference. This is where practitioners need to listen closely, because sometimes people feel inclined to describe a really significant difference. They describe the difference they're ultimately hoping for. Well, a 1 point difference would mean, I'm able to walk for 25 kilometers in a day, and I can take 30,000 steps and still feel energetic at the end of the day. So that's a wonderful, wonderful vision, but it's kind of sounding like 11 or 12 out of 10 to me. I really want to know what that 1 point difference is from where you are right now. Having established what that 1 point difference is, all we do then is encourage the patient to go away and start that. And that's it. And the quick intervention for change is iterative, which means the next time the patient comes, you can be curious about what they've done in terms of taking that 1 point step, and so on. One more step in the process is to get a sense of the patient's confidence to make that change. Confidence is very important in motivational terms, and in fact, the importance of a change and the confidence to make that change are really the two dimensions of motivation. If a change is not important to me, I'm not going to be motivated to do it. If a change is important to me, but I don't feel confident to engage in it, I'm probably not going to make a start either. So the first part of the quick engages people around the idea of importance. The second part engages the idea of confidence to start making that change. And the rule of thumb that I use here is if someone's confidence is about 7 out of 10 or higher, then I would go ahead and encourage them to begin that change. If it's lower than 7 out of 10, I'd have them share with me in what way they might be able to modify that step slightly so that their confidence increases a little bit. I want to send my patient away feeling not overly confident, but reasonably confident that they can engage in this particular process that they've described they want to engage in themselves. So that's it. Whole thing can be done, with a bit of practice. The whole thing can be done in 4 or 5 minutes in conversation. It's intended as a brief intervention. It's intended to spark curiosity in the mind of the patient, and intended to do something concrete that the patient can then walk out of your surgery and get into. So that's it.
Thanks, Simon. That's brilliant. Yeah, I love the way that you've explained all of those different stages. So yeah, looking forward to the demonstration.
Yeah, wonderful. Well, let's do that, shall we? So shall I call you Lydia?
Yes.
Or would you like me to? Okay, all right.
Lydia's fine.
Call you Lydia. All right. So, Lydia, I wonder whether you could share with me an area of your health and well-being that you'd really love to see some change in at the moment.
Well, Simon, I'm a little bit concerned about my weight. It seems to be creeping up, and I'm definitely going through menopause at the moment. Mm-hmm. So I know that from what I've heard from my friends, it seems to be something that women struggle with, and mm-hmm. it's really worrying me because I don't want it to get out of hand.
Mm-hmm. Mm-hmm. Yeah. Mm-hmm. What is it particularly about managing your weight and keeping it in hand, as it were, that's important to you?
Well, I've noticed that my energy levels are not great, and I feel that there's a connection there between mm-hmm. Between the increasing weight and low energy.
Mhm, mhm,
And I guess that really worries me because my work is very important to me.
mhm,
I have a lot of projects on the go, and
mhm,
I'm really concerned that I'm not going to be able to continue working and giving it all,
mhm, mhm,
giving it my all. And
mhm.
yeah, that's
Yeah.
that's such a concern.
Yeah, wonderful. You sound very passionate and very dedicated to the work that you do, and you want to be able to continue that, and you want to continue it with a bit of energy and passion, with some fuel in the tank.
Yes, totally. There's so many
Yeah.
things that I still want to do and
Yeah,
contribute, and
wonderful.
yeah, and I don't want
Wonderful.
to not have the energy to do that.
Yeah, yeah, of
Yeah.
course, of course. I wonder whether you could share with me some ways, even small ways, in which you feel like you're already managing this part of your health and well-being well. Ways in which you feel like you are attentive to your body weight, you are generally attentive to your health and so on. What's working for you?
Well, I think what is working at the moment is that I am able to keep to an exercise routine. So
Hmm.
I'm doing exercise about 3 times a week,
Hmm.
and I've been able to stick to that. So I think
Hmm.
that's going well. I'm quite proud of that.
Uh-huh, uh-huh,
Yeah.
uh-huh. So exercise is one thing. What else might be working for you at the moment?
Um, well, I'm more aware of alcohol as well.
Hmm.
So I have cut back on that.
Uh-huh,
Usually my husband and I will have a few glasses of wine over the weekend, and
uh-huh,
I'm definitely cutting back on the alcohol.
uh-huh,
So
uh-huh.
that's going pretty well.
Uh-huh. So you've been simultaneously attentive to boosting and maintaining the exercise and winding back the
Yes.
alcohol a little bit. Yeah,
Hmm.
wonderful, wonderful. So Lydia, let's imagine that 0 out of 10 represents having made no progress towards this idea of managing your weight well that you're sharing with me, and 10 out of 10 means that you are doing everything that you want to be doing to managing your weight well, and you're experiencing success in that.
Mm.
Just off the top of your head, where would you rate yourself right now?
I think I would say I'm about a 6 out of 10.
About a 6 out of 10. Okay,
Yeah.
okay. To share with me a little about what that means to you.
Well, I know I'm doing quite a few things.
Hmm.
So, uh, but I know that there's a lot of room for improvement.
Okay, okay,
Um,
okay.
yeah.
Yeah. Happy with what you're doing, and at the
Yes.
same time, there's more to be done.
Yes.
Yeah,
Yeah.
yeah.
Definitely. Mm.
So I wonder if you could tell me. So, given you're at 6 out of 10 right now, if you were able to just take that small step to 7 out of 10, what would look different at 7 out of 10 from now?
Um, I think I think that I would be more organized. At the moment, I just feel like my family and I we're not eating as well as we could, and
Hmm.
I've always been interested in healthy eating, but at the moment we are working I'm working late and not getting enough time to prepare meals, and so we're just grabbing ready-made
Hmm.
meals from the
Hmm.
supermarket, and
Hmm.
so I
Hmm.
feel like a 7 out of 10 might be that I'm more organized. Um,
Okay. Okay.
I'm preparing more food at home from scratch.
Okay. Feeling
Yeah,
a little more organized
a
around food
little.
preparation
Yes,
and managing your diet generally, and for that matter, the diet of your family as well.
yes.
Yeah, yeah, yeah.
Mhm.
Wonderful, wonderful. Okay, okay. And what might that involve? That organisation? Help me understand that a little bit. Is that to do with recipe preparation, or is it to do with thinking about what goes in the diet? Is it to do with where you shop or when you shop, or what dimensions of that are important to you?
I think it would be, I think a good idea would be to perhaps take some time over the weekend, maybe on a Sunday, just to think about what we're going to eat for the week, and maybe do some prep
Okay.
when I've got the time, because the weeks, you know, with 2 teenage boys in the house, and they have so many activities. The week goes so quickly. Monday starts, and before you know it, it's Friday. And yeah.
Okay. So taking that little bit of time to get organised on the weekend.
Yes.
Think about the week ahead. I'm hearing in this perhaps a sense of cascading in your mind, that once you do that, then you'll get more organised to shop. The shopping will be more straightforward. The meal preparation will follow, and so on.
Yes, exactly.
Yeah. Wonderful. And if I were to ask you, Lydia, using a similar scale, 0 to 10, to share with me how confident you feel to start doing that this Sunday. Saying 10 out of 10 is the highest level of confidence. Where would you rate yourself right now?
Sure. Again, I think I'd probably say about a 6.
About a 6.
Yeah.
About a 6. And if we could find some way of boosting your confidence just a little bit, so that you maybe were able to hit 7 out of 10 confident, how could we modify what you're thinking so that you would feel that little bit more confident?
It would really be good to have the support of my family.
Okay.
Yeah. At the moment, my boys and my husband, they depend on me so much to provide the meals. And I feel like they're just not supporting or helping in any way. And if I could just get them on board, get them to help, maybe my husband could help me with the prep on the weekend, or just to have their support would make a big difference.
Yeah. Okay. So it's sounding perhaps like the first step here is a conversation with your husband about doing this, with a view then to doing it.
Yeah, I think that would work. Yeah. That would be a good
And
idea.
if I asked you about that, if I asked you on that scale from 0 to 10, how confident are you about having a conversation with your husband this weekend about doing that? Where would you rate your confidence now?
No, I think that could work. I would say about 9 out of 10.
Wow. Okay. 9 out of 10.
Yeah.
9 out of 10. All right. I wonder whether I could leave that with you as a challenge for the coming weekend.
Okay, so I'm going to sit down with my husband, tell him how I'm feeling, and ask for his help. Yeah. I can do that. Yeah.
Wonderful. All right.
Okay. Thank you so much.
Yeah, pleasure. Thanks, Lydia. So, Lydia, what I might do is just share a couple of my own observations about that process, so that as people are considering what they've seen, they can extend that thinking. The first thing I want to comment on is the way silences were allowed to be there. I wasn't rushing to fill the space with words, and when you were taking time to think and reflect on something, I was allowing that. And part of the reason for that, of course, is that for me, silence is a signal that I've asked a question that you haven't previously considered before, and that's valuable.
Yes.
That means you have to rearrange your thoughts, rearrange your ideas to produce the response to that question. So letting silence sit there is important. One of the things we saw was the value of asking about that 1 point difference. The conversation began with the idea of focus on weight, and the things that you were doing well were exercising and cutting back on alcohol. If I had put my expert hat on, I might have stepped in and said, well, I think you should do this, or I want you to do that. But when I asked you, your solution, the solution that would work for you, was to get more organized in order to prepare meals. Now, I, as a practitioner, wouldn't immediately think of suggesting organization as a strategy for doing this. But in the way that you're thinking about it, it's very important, and it's the first step. Well, in fact, it's the second step, because you rated your confidence only about 6 out of 10. And when we explored that, the first step is actually having a conversation with this other significant person in my life about this.
Mm.
When I'm able to do that, then I feel like I'm going to be setting myself up for success.
Yeah.
So it was actually so the whole conversation was a lovely illustration of the importance of attending to where the patient's energy lies, what the patient wants to do, how they construct the flow of events and the flow of strategies that they need to follow. Not something that I would, with all my psychological training, suggesting to someone that they should go away and practice higher levels of organisation is not something that I would immediately think to do. So,
Yes.
yeah.
No, that was a really great example. It's so true that it can feel so overwhelming in the beginning. We set ourselves these high expectations, or we have the high expectations. We set ourselves these high ideals, and yes, we really need to simplify down to one first step that you can take.
Yeah.
Brilliant.
Wonderful. Thanks, Lydia.
Thank you so much, Simon, and we look forward to inviting you back next year to present to SALMA again, and to all our health professionals.
Thank you. It would be my pleasure.
Thanks for your time.
Yeah, pleasure. Thanks, Lydia. Bye now.
Thank you so much for that wonderful presentation. I know we're a bit short on time and we are running a bit late. So I would like to propose that we do our wonderful draw, because we are giving away the air fryer for everyone who signed up before the end of May. And if you have any questions, Lydia, would you mind maybe popping in the box the email address, and everyone can email you the questions?
Yakira, can I suggest that we stop the recording at this point?
You don't want us to record the raffle?
No, because this is going to be on our website.
Sure. We can stop the recording. Roxy, can you just stop the recording? And